In this topic, we'll be finishing up the cardiovascular or circulatory system topic, talking about cardiovascular disease, problems that affect the heart and the associated blood vessels. What you can see here on this intro screen are two things. On the left, you'll find this GIF that is showing the buildup of plaque inside an artery wall, potentially leading to a blockage. We'll talk about that more. And over here on the right, you can see these arteries that actually supply the heart tissue itself with oxygen and nutrients, called the coronary arteries. And they've washed away some of the other cells, so you can see these more clearly. They're actually kind of beautiful. They look sort of like tree branches branching off into these arterioles and then into capillaries that then feed the heart tissue itself. And if those get blocked, we can have potentially a heart attack occur, which we'll talk about as well. So here are a variety of risk factors for developing cardiovascular disease. Some of them you can't control, like as you get older, your chance for this disease increases, mainly due to lifestyle choices, lack of exercise, poor eating, but also just to like wear and tear on your blood vessels. Also your genetics, some people do all the right things, but they still get heart disease, cardiovascular disease. You can blame your parents for that. And then your sex, whether you're biologically male or biologically female, males have a higher tendency to get cardiovascular disease than females do for a variety of reasons. Over here, things you can control, exercise, eating well, your weight to a certain degree, stress, etc. Some of these, again, there's genetic components like cholesterol, blood pressure, even obesity and weight. There are genetic components, same with diabetes, but there's things you can do to try to manage them. Down here you might see Netflix. Well, I'm not picking specifically on Netflix, but anything where you're sitting sedentary for a long period of time, and Netflix has kind of been the leader in this like binge watching. If you guys aren't familiar with that, that's just watching like a whole series in a short period of time, where you sit down, you don't get up for a long time. Sitting for more than 30 minutes at a time is actually bad for your health because it reduces blood flow and it can lead to long-term increased chance of cardiovascular disease. So you should get up for a certain amount of time, at least every hour, and move around a little bit. So I'd mentioned that GIF in the beginning was showing this plaque formation inside of arteries. The name for this process is atherosclerosis, the formation of plaque inside the artery walls. Well, what is plaque? Well, it's the same name as the plaque on our teeth, but it's a completely different thing. Plaque on our teeth is a layer of bacteria that have formed, that have hardened, and they're hard to get off. Plaque inside of our arteries is fat, cholesterol, hardened with calcium and some other substances that can reduce blood flow. And if that blood flow gets narrow, it can lead to reduced oxygen and nutrients, leading to potentially fatal effects. We'll watch a short video that's going to talk more about this process.
In the United States, coronary heart disease is the #1 cause of death for both men and women. Coronary heart disease is a disease in which a waxy substance called plaque builds up inside the coronary arteries, which supply oxygen-rich blood to your heart. The buildup of plaque over time causes a hardening and narrowing of the arteries called atherosclerosis. Atherosclerosis can lead to serious problems, including heart attack, stroke, or even death. Healthy arteries are strong and elastic. They become narrow between heartbeats, and they help keep your blood pressure consistent. This helps blood move through your body. In atherosclerosis, plaque builds up inside your arteries. Plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. Over time, plaque hardens and narrows your coronary arteries. The buildup of plaque limits the flow of oxygen-rich blood to your heart, which can cause chest pain or discomfort called angina. Eventually, an area of plaque can rupture or break open. If the plaque ruptures, a blood clot can form on its surface. A large blood clot can mostly or completely block the flow of blood through a coronary artery, which can cause a heart attack. Atherosclerosis is a common health problem. The main treatment for atherosclerosis is lifestyle changes, such as following a healthy diet, quitting smoking, and being physically active. You also may need medicines and medical procedures.
So just to remind us, connect this back to the nutrition topic, there are these two main types of cholesterol. LDL was the bad cholesterol. Remember I said the way to remember that. L you can think of for lethal, and H for healthy. So that your dietary choices, if you have a lot of saturated fats, you're increasing your LDL, which is going to increase the chance of developing plaques, increase the chance of atherosclerosis occurring. Whereas HDL, found in unsaturated fats and healthy fats, is going to reduce that chance. So you want to maximize your HDL up to a point. You don't want to eat too many calories of fat overall, and have less. Reduce your HDL by reduce your LDL, pardon me, by reducing your saturated fat intake. So when atherosclerosis occurs anywhere, it's not a good thing, but it's especially a problem in the heart, the brain, kidneys, a few other vital organs. And if plaque buildup happens inside of the heart, it can clog these coronary arteries. Coronary arteries actually bring, like I said before, oxygen and nutrients to the heart tissue itself. And we call this coronary heart or coronary artery disease if plaque starts to form inside of them. This can lead to a heart attack. And I'm not going to show you guys this video, but if you want to, again, use your phone and scan this area with your camera to watch this video. It's a good one describing what a heart attack actually is and how it happens. So a heart attack commonly is a misconception thought about the heart going really quickly and then it stops. That's not a heart attack. That could potentially lead to a heart attack, but it's not a heart attack. A heart attack is when part of the heart dies, and it dies due to not getting enough oxygen and nutrients. So in this case here, we have a blockage. We have atherosclerosis, a plaque that's formed. That's now cut off oxygen and nutrients to this part of the heart down here. That part dies due to lack of oxygen and nutrients. That's a heart attack. And depending on where that blockage occurs, if it happened up here, you would have a much bigger chunk of the heart potentially that could die, right? That'd be a major heart attack versus a minor one, and you probably wouldn't survive that. If this happens in the brain instead, it can cause a stroke, where part of the brain dies due to lack of oxygen and nutrients. And so before, when I had said a fast heart rate isn't a heart attack, but it could lead to a heart attack, here's how. So let's say you've got one of these arteries that's partially blocked. Okay? So it's a little bit narrower than normal, but it's not completely blocked. If all of a sudden you get scared or exercise or something happens where you try to get a lot of blood going through there, that narrow area really quickly, it could lead to a complete blockage, then leading to the death of that tissue. So that's how that could occur. So what can be done? Well, the video said diet and exercise are the most important things, but sometimes the blockage is too severe for that. And so we'll talk about some possible treatments. One is to get some drugs to lower your LDL, your bad cholesterol. And there's a category of drugs called statins that do just that. They block the ability of your body to make this cholesterol. And they can also help to lower cholesterol potentially by removing it from some of the plaques that are already there. And there's a variety of brand names you may have heard of from advertisements that perform similarly. But sometimes these drugs won't act fast enough. You need something more immediate, which would require a surgical procedure in them. So let's talk about that. One thing's called an angioplasty, sometimes called a balloon angioplasty, because of the way it works. You take this catheter, a tube, and you thread it down into the spot where there's this partial blockage. At the end of this catheter, there's a balloon that's deflated, that's released, and you pump up that balloon, and it opens up the artery. You deflate the balloon, and you remove it. Sometimes that stays open, other times it just seals back up again. So a lot of times, in addition to an angioplasty, after it opens up the blocked artery, you have something called a stent that gets left in place. And that stent is going to stay in there permanently. When you remove the balloon, this mesh-like structure stays in there and holds it open. Oftentimes, stents are laced with drugs called anticoagulants. An anticoagulant is something that prevents clotting, prevents the blood from getting stuck there. And it's going to release this anticoagulant small amounts over long, long periods of time to help prevent a future plaque or blockage from occurring there. In the heart, sometimes it's so severe that you need to perform what's called a coronary bypass operation. You may have heard of a triple bypass, or a quadruple bypass, or a double bypass. They're all referring to this process where you take veins, typically from your leg, and you remove those. Luckily, you have enough veins that can act as collateral circulation, where if you remove one vein, unless it's a major one, you're likely to be functioning just fine. With arteries, you typically can't do that. And so you take veins from your leg, and you use them to reroute blood, you can see here, around these blockages. In this case, there's 1, 2, 3. This would be a triple bypass. 1, 2, 3. If there's one more, we call that a quadruple bypass, to get blood to go past the blocked areas so that blood flow can continue. One of the problems, let's say that that's not enough, or you've had several heart attacks, your heart's in bad shape, you might need a new heart. Well, you can either get a mechanical heart, which still does not work as well as an actual human heart, or you can wait on the donor list. If you're lucky enough to get a heart, you have to be on what are called anti-rejection drugs. For the rest of your life, to make sure that your immune system doesn't destroy the donor heart, because that donor heart has markers on it that indicate it's not yours. And this video here is showing researchers that are working on removing those markers and then reseeding the structure, the scaffolding of that donor heart with your own cells, and then putting that into you so that you can then have a heart that's much more like your own. Still a ways away, but in the future, this could be a possibility where you could just take a donor heart, or maybe print out a 3D model of a heart, put in your own cells, and then grow it. It's amazing what we could be able to do, maybe even in our lifetimes.